The first time I started with the Gabapentin, I was very, well, excited, but didn't want to get too excited because if it didn't work, I would have to keep scratching. So I took it directly after dialysis because, that's when I'm really scratching, and carried on with doing the dishes as I normally do after 12 o'clock when I get home. And at 2 o'clock I realized that I hadn't scratched. I thought, oh, maybe this is the tablet. I thought, just carry on and wait until the evening, because that's when I scratch, obviously, before I go to bed, to try and go to sleep. And 10 o'clock I got into bed feeling quite sleepy, which was unusual because I'm normally restless, and had that really relaxing, heavy limb feeling in bed that you would normally feel, which I hadn't for years. And I thought, oh, this is quite good. And I was fast asleep. Next thing I knew, I got up once, I think, to scratch during the evening, but got back into bed and had the most wonderful sleep. So woke up feeling refreshed for the first time in a long time, and thought, well, maybe this is it. Started having breakfast, and the itching was there, and I thought, maybe not. Maybe it was just me. I thought, well, let me do as the doctor said, and have the tablet, and I had it in the morning again, and that whole day there was nothing the whole day, which is silly to someone who hasn't had it. But when something is on your mind constantly, it's such a relief. And I started getting excited because I thought, if this can do this for me, what can it do for how many other dialysis patients are living like this? And I was smiling the whole day because I was so excited that there was something that could make such a drastic difference. I do know that some people do have quite bad side effects with Gabapentin. Thankfully not me, but if they do, they can use pregabalin, which they've had good results with as well.